So a little bit about our presenter. Dr. David Campbell is a medical specialist in endocrinology and metabolism and a health services researcher focused on social disparities and their impacts on clinical outcomes of cardiometabolic diseases like diabetes. He's the co-director of the Health Policy Trials Unit at the O'Brien Institute for Public Health at the University of Calgary. He conducts research that uses mixed methods, interventional approaches, community and stakeholder engagement, and knowledge translation to contribute to reducing the impact of social disadvantage on clinical outcomes by informing health policy and clinical practice. So thank you very much, Dr. Campbell, for being with us today, and I will turn it over to you.
Thanks, Megan. Thanks for having me. It's a pleasure to be here with you today, and nice to see a few familiar faces or names in the audience today. So I'm going to share my screen and we'll get started. So I'm going to be speaking today about using community-driven arts-based methods to communicate lived experiences as a knowledge mobilization tool. So a big caveat and preface that I always start with is that I am not an artist, actually, and I actually have very little artistic inclination or talent. And so I will come back to this again, but one of my last slides is really that I think what really makes this work and this type of work happen is to have the right people on your team and to surround yourself with people who have the breadth of skills that you may need to consult to make these kinds of projects happen. And some of us are gifted with artistic talents and some of us, like myself, are not. And so if you want to use artistic arts-based methods, I think it's quite important to have that respective expertise in the room with you. As was mentioned, I'm speaking to you today from the city of Calgary, which is the traditional territories of the people of the Treaty 7 region in southern Alberta, and that is home to the Blackfoot Confederacy, the Tsuut'ina First Nation, and the Stoney Nakoda First Nations. And the city of Calgary is also home to Métis Nation of Alberta Districts 5 and 6. So I'd just like to start with the land acknowledgement. I was born and raised on this land, and I'm privileged to have been able to come back and work here as a professor at the University of Calgary, and grateful for all the traditional keepers of this land and for the opportunity to live and to work here. So just my objectives for the meeting today. I hope that by the end of my presentation that you will that I will explain different forms of arts-based methods to translate knowledge or mobilize our research knowledge. I hope that you will understand the potential role of arts-based methods for reaching different audiences and be able to think about how you may or might want to incorporate these techniques into the KT work that you do. And I also want to describe some ways that my team has evaluated the impact of our arts-based knowledge mobilization efforts and that you might consider doing as well, because as we all know, being able to demonstrate the impact of our efforts is always critically important. So that's something that we've been working on as well. So that's the roadmap for today. And just to start, as I mentioned, I'm not an art person. And if you'd asked me 5 or 6 years ago about the intersection between the arts and the sciences, I would have thought that there was very little overlap in the Venn diagram of arts and sciences. Over the past number of years, I've come to realize that there's actually a lot more in common and that there are some important similarities and areas of synergy between the science world and the arts world, and that's what I'd like to talk to you about today. I really like this quote that I found from Levy, who's one of the experts in the field, who said that historically art and science have been polarized and erroneously labeled as antithetical to each other. However, art and science bear intrinsic similarities in their attempts to explore, illuminate, and represent aspects of human life and the social and natural worlds of which we are a part. So in this respect, we can possibly think about art and science as being kind of two sides of the same coin, that really they exist to help us understand the world around us and help us to understand other human beings, and they do so in different ways. And really the idea of arts-based research is how do we leverage the respective strengths of the arts and the sciences to kind of bring them together. There's a lot of different words, and I think that's one of the things that makes this area particularly confusing is that there are lots of different terminologies used to talk about arts-based research. And these are a number of them. I think that this is 10 years old, so I think in the last 10 years, there's probably another 10 or 20 different terms that can be used to describe some of this. And in the literature, all of these terms are used. But you may have encountered some of these in your work. I found artography an interesting one. That's actually a Canadian term that was coined at UBC by some arts-based researchers. That stands for artistry, research, and teaching. And that's what art, A/R/T, ography means. So that's one way of describing what I'm going to talk to you about today. But if you think about the history of this is relatively new in the world of of science in terms of how do we merge arts and sciences together. And if we think historically and we look back, there's a big talk about what's now called the narrative turn in social science research that happened in the 1960s through to the 1990s. And this is where there was a real shift in the focus from numbers to stories, and where there was an increasing awareness of the importance of narrative-based research and of people's lived experience. And if you go back to kind of social science research in the 1950s and before that, it was really dominated by quantitative positivism, sociologists studying trends and demography. And as we got into the latter half of the century, there was an increasing focus on the qualitative data that could emerge from people's stories and lived experience. And in the midst of that, Elliot Eisner, who is a professor of education at Stanford University, coined the term arts-based research. And that was in a keynote address that he gave at the big American conference on education, and talking about how we could study educational initiatives using art. And I like this definition by McNiff that was elaborated, about less than 10 years later, but I think, captures the construct really well. And it's the systematic use of the artistic process, the actual making of artistic expressions in all of the different forms of the arts, as a primary way of understanding and examining experience by both researchers and the people that they involve in their studies. So, a big question is, are we now, I think a lot of times in the health field, we often are trailing our colleagues in social work and education and nursing. And in medicine especially, I think we trail behind nursing researchers in terms of innovation many times. And I think that in the world of medicine, we are now having our narrative turn. It's only taken us maybe another 50 years or so to get there. But I do think that in the world of health research, clearly clinical trials and quantitative studies are still important, but there has been an increasing understanding and awareness of the potential impact for people's stories. And that's really what arts can help us do. And especially in the world of knowledge mobilization, where I think I don't need to tell anybody in this room the importance of stories, and how stories are often more powerful at accomplishing mobilization of knowledge than just presenting raw data and numbers and graphs and charts. So we talked about arts-based research, but where does that intersect with knowledge mobilization? And so I pulled a couple of definitions here from CIHR and SSHRC about what is KT, or knowledge mobilization. And I'm sure this is not new to anybody, but really it's this process of getting research knowledge that's generated through research activities into practice in some way to help improve health services, in the case of CIHR, or to benefit people, Canadians, or people internationally, as SSHRC defines it. I really like to juxtapose this with this definition of arts-based methods, and arts-informed research is another term for that. And so I really like this quote that says that tied to moral purpose, arts-informed research is an explicit attempt to make a difference through research in the lives of ordinary citizens and in the thinking and decisions of policymakers, politicians, legislators, and other key decision makers. So to me, there's a very clear overlap in these two definitions, and a very clear role for how arts-based approaches can help us mobilize the knowledge that we generate through our research activities in a very impactful way. And so I want to talk a little bit about that and what makes arts so well suited to this idea of knowledge mobilization. And one of those is this idea of emotional resonance. And really that's the definition, that's really the idea that arts can speak to emotions, and it really brings about, rather than just a simple cognitive, through our research, a lot of times we can tell people things, but through arts, we can help people feel things. And I think that's the real difference. Eve says that art can induce emotion, can challenge understanding, and can be disrupting and disconcerting, serving to redefine how. It helps us to rethink our understanding of the world. And Wang says that emotional resonance is when the audience finds similarities with their own emotions or experiences in works of art, which lead to deep feelings and recognition, which can not only enhance the audience's memory and identity of the work, but also promote the emotional connection between the audience and the designer, making the design work more influential and communicative. And so, how many of us that are researchers would want our work to not only help people remember it, but also connect with it and feel deeply connected to the work that we do? And I think in many of the things, and when we're trying to mobilize knowledge, we're asking people to do things. Either we're asking providers to think about how they structure their clinical work in a different way, or we're speaking to policymakers and we're asking them to advocate for certain things. And if all we're providing them is knowledge, that's often not enough to get them to change their behavior and really take on that mantle of advocacy. Whereas if we can make them feel things and help them to feel the importance of the work that we're conducting, I think we're much more likely to succeed in our goals of knowledge mobilization. Then there's this idea of the aesthetic experience. And this is actually something that I didn't realize until I was learning about this. It's something that's spoken of quite extensively in the arts community and in the academic arts world, where they're talking about how do we create experiences for people to engage with the aesthetic, with something that you can see or feel or hear, a feeling, and have that create a lasting experience, something that is, translated beyond a sensory experience into an emotional experience. And this really helps to make abstract or difficult experiences tangible and accessible. And so if you think about this, I like this figure here from Markovich that basically shows that much of the research we do, I think, is at this perceptual level, right? And people perceive our work, they interact with it in some way, they read our abstract, they come to our conference presentation, and they will, using their cognitive abilities, appraise whether what we're saying is interesting or not. And if it's interesting, then it goes to this level of attention. Is it worth their attention or not? Is this something that they're going to just move on their day with, or is it something that's going to actually catch their attention? And if we're successful there, then we might be able to get to the emotion and the excitement and get them on board with us. But really, art really helps to kind of create this middle arrow here, where it takes the work that we're doing from this perceptual level to a narrative level. And that opens up this whole extra avenue of engagement with our work, where people can become not just interested in our work, but fascinated with our work. And beyond excitement, people can have this exceptional feeling that people can really, truly get on board with what we're hoping that they can do. And so I think that's really where we're hoping that arts-based research can take us, and where arts approaches can really take our knowledge mobilization to the next level when people engage with our work at this narrative level, at this feeling of connection and emotion with the work. Arts-based work also helps to break down barriers. Sometimes, seeing a photograph or a painting transcends language barriers, right? I think, certainly being, positioned in English-speaking world, fortunately, there's lots of audiences for our work, but not everybody reads our English language abstracts and papers, or comes to the same conferences that we go to because, they're speaking and working in different languages. And all of that can be transcended if we're able to package the knowledge into an artistic artifact rather than a text-based product. It also helps to overcome some of the educational and literacy barriers that exist. Rather than reading a complicated, scientific abstract or a paper, even if we've tried to kind of write it in kind of lay terms or simplified terms, there's still a level of education that's required to engage with that material. But when people are seeing a film or seeing something they relate to, that can really overcome a lot of these challenges that exist in the work, and as we try to scale it broadly. There are institutional barriers and cultural barriers, and people might not perceive the work the same way that we do if they haven't had the same prior experiences. And that's all true with arts as well. But I think that there is the possibility to really reach much more broadly with arts than we typically do with text, which I would say is our default go-to in the sciences. One last thing that arts helps us to do is it really helps to evoke that sense of empathy and advocacy. And this is taken from the Minneapolis Institute of Art, where they had this a social psychologist, a scientist, speaking about why the arts are so important. And so this person says that they're an empathy scientist and they study empathy and related behaviors. And so she was asked the question, what impact do you think that art can have on our ability as humans to be empathetic to a certain cause? And she says that she's examined this and she finds that different kinds of arts engagement can help to build empathy for others. And I really like this, that the arts can help to expand our minds and hearts so that we see our own and others' worlds better. I think that's where I always come back to, especially in the efforts of knowledge mobilization. That's often what we're trying to do, is get people to expand their minds, to see things in a different way. And we know that most of the time, as humans, we're not naturally inclined to see things through others, through the worldview of another person. And that's really what the arts help us to do. So I hope to this point I've been able to convince you that there are some really impactful consequences of using the arts in our work. And I want to show you some examples now. I think this is going to take the bulk of the presentation, because I think my hope is to kind of inspire you all as KT practitioners and as people that work in this field to think about how could you use some arts-based approaches in your work. And by doing so, I want to share some of the work that my team has been doing, as well as some of my colleagues, so not all of this work is mine, using different forms or different media of the arts. And I think that's what's really powerful about the arts as well, is that it's not one singular approach, but that there's such a breadth of approaches that can be used for different purposes. To really convey the messages and convey the results of our research findings. And so I want to take you through a number of these examples just so that you can get a sense of all the different things that are done out there. And this is, again, just a small snippet, a small snapshot of the different styles or media that can be used. So I'm going to give an example using kind of traditional art, like painting. I'm going to give an example of photo voice, which I'm sure many people are familiar with. I'm going to show you some examples using comic illustration. I'm going to show you a digital storytelling product. I'll show you an infographic that my team has made. And then hopefully, if the Zoom cooperates, I'd like to show you a couple of snippets from a film that my team has made using both documentary and narrative filmmaking techniques as knowledge mobilization products. So that's what I hope to go through next. So I will start with the product called the product of traditional art in the project called Reshape T1D. And this is a project that was led by Jamie Boisvenu, who is a PhD student at the University of Alberta, and his supervisor, Dr. Rose Young. And their initial study, where they started, was with an interview study using community-based techniques. So they had a community-based group, and they interviewed people with lived experience of type 1 diabetes. And their whole idea was to understand, how do people experience healthcare in Alberta with this condition? And how does age at diagnosis impact how people experience medical trauma? And what are the specific traumas that people experience when they are diagnosed with type 1 diabetes, particularly at a young age? So that was the objectives of their study, and they did these interviews, and they came up with a number of different themes that were quite illustrative and impactful, and they published these and they presented them. But then they wanted to do something a little bit different, and they wanted to think about how could they mobilize that knowledge around these themes to a broader audience and have people engage with it at an emotional rather than just a cognitive level. And they did something quite unique. They commissioned an artist, a local artist in Edmonton, Jasmine McGarra, to take the themes that they and the quotes that they generated through their research, and to depict these in a traditional painting series. And so there's an art collection, I think it's 8 or maybe 10 different pieces, and these are really quite impressive when you see them in person. This is obviously just a screenshot of it, but in person I've had the chance to see them. They're produced on a beautiful mixed media with texture and details and layers, and is really quite an impressive visual experience to actually see these and interact with them. But I really like how they're rather abstract. They're not people, they're not discrete things. I mean, you can make out certain things that are identifiable in this image. But what the artist has done is worked with the research team to think about, within the broad theme of trauma that emerged from their qualitative research, and looking at the actual quotes of their study participants, she created an image that is representative of those emotions. And so, I'll give you a moment to read through the description of trauma as Jasmine writes it. So it's quite deep, and as I said, a science first person myself, I'm not used to engaging with abstract art in this way, but I'm grateful for the description, because I can reference the image and go back to the description, and I can kind of see how there were emotions that were told by the participants in their study that are reflected in this visual imagery. And the idea again is that you can read the quote on the right and the actual quotes from individuals, but the image itself helps to put that into a feeling possibly, and that's what we're trying to do with this type of work, is evoke feelings in our participants. Um, so the next one, I just want to share one more, and this pertains especially to my research, which is largely focused around financial challenges, and this is what Jasmine painted to represent financial burden. And so I'll give you another moment to read through the description and look back, and as you read it, look back and forth between the image and the description. So again, it's quite interesting for me to see something so abstract represent experiences that are so concrete. And in the work that I do, and I know in the work that they did, they heard very concrete stories from their participants about how they couldn't afford their insulin, or they couldn't afford their testing strips, or they couldn't work because of their diabetes, and how that affected their bottom line. And to see all of that represented in an artistic, abstract work is quite interesting, but really kind of brings a different lens to the issue than just hearing stories, but seeing a feeling in an image. So I think that's kind of more on the abstract side of things, and I think the Reshape T1D team has done a really nice job illustrating that form of arts-based knowledge mobilization. I want to talk about something again much more concrete, and this is a photo voice project that my team did, and this is about 6 years ago now, when I was working at St. Michael's Hospital. We worked with the Toronto Clients with Diabetes Advocacy Committee to create a photo exhibit using a photo voice methodology. And so if you want more details, you can see our publication there in CMAJ. But I'll walk you through what we did exactly. And so we used photo voice, and this is using a group of people with lived experience of diabetes and homelessness who got together and decided together that we wanted to use photo voice. And to get there were a number of steps that we needed to follow. We were trained the group in research ethics, and kind of what needed to be done to take photographs ethically and to respect people's privacy. We gave every member of the group a digital camera and taught them how to use it, how to work, what are the basic functions, how to zoom, how to use the different portrait landscape functions. But even beyond that, we brought in a local photographer who worked with the group to train them on some basic principles of photography, and how to compose a nice photograph that's visually appealing, and what lighting should be, and how to not get a backlit photograph. And again, these are skills that stretch way beyond my skill set, and so we did bring in a professional photographer who worked with the group on a number of sessions to teach them these skills. And as a group, they then decided on specific research goals, or what were they going to take photographs of. And they decided they were going to take photographs of two different things. One was one that illustrated what it made it challenging to eat well with diabetes while experiencing homelessness. And secondarily, that they would take a photograph that depicts something relating to homelessness that has either been a major help or barrier to diabetes self-management. And the group went off and they took photographs and they brought them back. And the analysis method that we used with them to generate a narrative that goes with the photograph is the showed method. And this is a long-standing method used in photo voice research and in other arts-based research to really elicit what they're trying to illustrate with a photograph. Because a lot of times the artist themselves know what they're going to display, but trying to get them to tell the story around that image or what the feelings are they're trying to convey is a different matter. And so in some ways, this is the opposite of the process that was undertaken by the Reshape T1D folks, where they started with the stories and the artist created the image that represented those stories. In this sense, they took the image and we created the narrative afterwards by asking each individual photographer, what do you see here? What is happening here? How does this image relate to diabetes in our lives? How does this relate to homelessness in our lives? Why does it exist and what can be done about it? And so that's the showed method, which was really quite useful in eliciting these stories. And so I want to show you some of the examples that came from this. And so there were a number of themes that arose from the images and narratives that were generated. And so the first theme is the emotional cost, where people really spoke through their images about the major demands on emotional and mental health that impaired their ability to focus on diabetes self-management. And one of our group members named Matt took this photograph of somebody sitting in a McDonald's, and he respected our advice around confidentiality to make sure that a face or identifying stuff was not visible. And he wrote this reflection. He speaks about this individual initially quite beautifully about what he sees, a solitary figure sitting there inside the McDonald's. And then he reflects and says, I see myself in this picture, except instead of a guitar, I'm hunched over a cell phone using the restaurant's Wi-Fi. A large chocolate milkshake and 2 McDoubles provide the highlight of my day while also allowing me to slowly kill myself due to my type 2 diabetes. McDonald's is everywhere, open 24/7, cheap, and most importantly, familiar. Everything always tastes the same as I remember it. This dependability literally sugared the pill of chaos I was forced to swallow every day while homeless. The fear of future diabetic complications didn't even register when each moment was a nightmare. And you can see how this image really illustrates the sentiments and the feelings that Matt was trying to convey. And in many ways, these were feelings that Matt had never even put to words before he saw the image. And so even for himself, the image served as a catalyst to create a really powerful narrative and story that would not have been possible without the photograph in the first place. And so really quite a powerful, compelling story. Another one that really shined through was around the foods provided in shelters. And this is something you can read about in the literature. There's lots of nutrition studies and other studies that have shown that the food in the shelter is not very healthy. And that's well known, but to see it depicted in this way takes it to a whole separate level, right? This is a photograph taken by Anna. And she says, where do I begin to tell my story about living with diabetes? Not only am I homeless, I'm being fed foods that are high in sugar and definitely not diabetes friendly. On top of that, there's no place for us to prepare our own food. Asking for more diabetes-friendly foods is like asking them to prepare a gourmet meal. Really? I'm not asking for steak and filet mignon. I'm asking for some veggies, fruit, water, something that can help me control my sugar level. Surely there's something that we can do to offer the homeless a wider variety of foods. Can't say I'm not grateful for what I'm fed, but that doesn't mean I'm happy with what I'm offered. It's bad enough we're homeless. Why must we be hungry too? And, seeing those words juxtaposed with this image of breakfast, half an orange, a cracker, and a cookie, in addition to what that would do for your blood sugar numbers, I think any of us looking at this image can imagine that you'd eat that and be hungry 5 minutes later with no real substantive nutrients. But the image is so powerful. People also spoke of the expense of food once they're housed, so that the challenge of food costs don't go away once somebody is housed through a supportive housing or other program. And this individual took a photograph of her food hamper that she received, and reflected on it to say basically, and it's really quite a striking image. If you know anything about diabetes-friendly foods or even healthy foods in general, you can see that really this is really antithetical to what any diabetes specialist would want their patient eating. All highly processed foods, sugar, potatoes, um, noodles, corn squares is probably the healthiest thing on this entire food box that she received from the food bank. And beyond her words talking about how it's hard to get nutritious food from the food bank, to actually see it and to see what she pulled out of there and to see that literally there's not a single thing there that would be in any way facilitative to somebody's dietary management of their condition is really quite striking. And this is one of the best examples I remember of just really being shocked by how powerful an image can be. And lastly, the last theme from our photo voice exhibit spoke about the access to medical supports. And so, this individual created a narrative called Patient Pays. And she says $97.14. Are you kidding me? That is for 1 week of meds. And she speaks about the challenges of needing to balance the cost of her drugs with the cost of trying to eat healthy. And speaking about, when you're homeless, your medications are often getting stolen from you and you're needing to double and triple pay for your medications. And speaking about, the injustice that goes along with that. As a homeless diabetic, I have to decide if I eat this week or if I refill my prescriptions. So again, a relatively simple image of an everyday item, but paired with the reflection of somebody who's lived this experience, really brings to life what she must have been feeling, and I think gives us that emotional connection to her that we probably wouldn't have had just with her story. So there is something unique about the imagery that we get through a photograph, and that's again a powerful testament to me of the impact of arts-based approaches and why they're important for us to think about in our knowledge mobilization efforts. We were able to take these photographs on the road. We had art exhibits or photo exhibits shown across the country. This is at the Canadian Alliance to End Homelessness Conference in Edmonton. We presented them at the Diabetes Canada Conference in Winnipeg that year. We showed them at a number of hospitals throughout the Toronto area, as well as here in Calgary and other places, and gave our community-based artists, a chance to display their work and to be there to talk about the impact of their experiences on them. And I think we got unanimous feedback from people who attended our photo exhibits that it was truly impactful. And even recently, somebody referenced, not even talking to me, but in another meeting, they said, well, the most impactful thing I've ever seen at a conference were those photographs, that somebody presented a number of years ago. And so this is 5 or 6 years ago, and people are still talking about it. And I can't say about any of the other work that I've ever done that people still talk about a presentation that I gave years ago. But because this was so real and had that emotional connection to it, I think that's why people had such a lasting impression of the work that we were able to do. Moving on to the next media that I want to talk about is using comics or illustrations. And this is not work that I've done, but work that my student Matt Larson has done with Al Martin in conjunction with Diabetes Action Canada and Obesity Canada. And Matt and Al were fellows from Diabetes Action Canada, and they were KT fellows, and their job was to take some published research and think about novel ways to present that and mobilize the knowledge. And so they came up with a project called Flipped Scripts that is all about overturning stigma for people with diabetes and obesity. And they started again with research, the literature that shows that people who live with obesity or live in larger bodies face stigma, particularly from their healthcare providers, and they often feel like the quote unquote help that is offered by healthcare providers is not all that helpful. And there's research evidence that supports this. And so they said, well, how do we get this knowledge to really impact the healthcare providers that we want to talk to? This isn't super new knowledge. This is knowledge that has existed. But in spite of that, healthcare providers persist with their ineffective modes of communication with this population in many cases. And so they wanted to think about, could we use illustrations? And I think Al is an illustrator, and so they were able to use their talents to portray the experience of of one of their experiences, and actually they're both of their experiences, but this is this story, and so the reflection of this gentleman illustrated says that, his cardiologist told him that he needed to lose weight, and after giving me a photocopy and an article about diet and exercise, he started talking about the benefits of walking and switching from sugar-sweetened beverages to carbonated water. And the big reflection is that after 35 years of hearing the same advice, doctors still had nothing new to offer. And he says it left me feeling hopeless and alone. Again, that's kind of research data. And so what can be done about it? And so, this is again, this is the reflection. This is the interaction that they're hoping to portray between this doctor and the patient. And the hypothetical question of what else could the doctor do to help Matt with his type 2 diabetes and obesity? And then they portray a flipped script, or kind of what could have happened. And so, what if the doctor said, asked for permission? Is it okay if we discuss your weight? And then propose a program that mixes these things together and ask the patient for their consent and their interest in participating. And really the message they're trying to convey here is that there are things that can be offered to patients living with obesity, and if providers are willing to work in different ways, evidence-based ways, they can be more effective in their objectives of helping their patients achieve their goals. And really, I think quite an effective tool that can be seen in a matter of seconds, right? As opposed to reading papers or journal articles or even watching a movie. You can flip through this comic in a matter of seconds, and it can be kind of a gut check for doctors who are maybe providing the former type of care who'd like to be doing more of the latter type of care. So I think that was the objective of this project, to really kind of mobilize that knowledge in a way that's digestible and also potentially impactful to the viewership. The next one I would like to share, I'm going to actually stop sharing for a moment so I can share this sound, is using digital storytelling. And so this is where you can use a variety of media, either use often photography, to share somebody's story. And this is not one that I was involved with, but Alberta Health Services, working with a friend of mine, Mike Lang, who's an expert in this area, helps patients to tell their stories digitally through these media that are really quite impactful. And so this person's story, named Shelley, tells about her experience of living with financial challenges and health conditions. And so hopefully the sound and video work okay for you to see this. If not, you can find it on Alberta Health Services channel to watch at a later day. It's publicly available on YouTube.
I have lived in the same home since 1967. It has seen me through good times and bad times. Times when I had plenty and times where I had little. And recently, numerous health issues. Fibromyalgia, amputation of my toes due to a blood clot, ovarian cancer, PTSD, and all the financial stressors that go hand in hand with serious health issues. The one constant I have had through all the ups and downs is my home. Even though I'm on a fixed income, I was making it work until one afternoon I received the phone call. You owe the city $9,000 in property taxes and you have 12 months to pay or we will auction off your home. The image that struck me in the face was the farm auctions in the 30s. People forced to watch their life slowly erased and sold with every gavel strike. That was not going to happen to me. I was able to take a side gig to make the extra money, but with my pension and disability, I'm limited in how much I could make. And then COVID happened. The side gig disappeared overnight, and because of my fixed income amount, I didn't qualify for any COVID financial supports. So I kept paying bills as much as I could, relying on credit cards for food and medications, often making the decision to buy one or the other. I connected with some supportive services and was sent gift cards and food hampers, but the snowball had started rolling and there was no stopping it. One afternoon, there was an envelope taped to my door as I went out to pick up my medications. This time, the bank was foreclosing on my house unless I could come up with $25,000 in 6 days. Standing in front of the pharmacist, I had to tell him, I can't afford to buy my blood thinners today. You can't go without them. I know. I have no money, so what do I do now? He paused for a moment. Well, you can have these 20 for free. Will that get you to your next trek? The snowball continues to gain momentum, and I'm acutely aware of how close I am to losing everything. I never thought that I would have to make choices between essential services like electricity, gas, phone, internet, medications, and food. Yes, a house is an asset, but where am I going to live in the city for half the value of my home? It feels like there's no way out, and there's no getting away from it. I want to live a healthier life, but right now the food insecurities and financial insecurities are overwhelming. I think it can be easy for healthcare providers to see a health problem and offer a solution, but in my experience, it's never that simple. Living a healthy life goes well beyond the hospital walls.
So I think Shelley's story, I mean, that's a 3-minute video that I think tells quite a compelling and powerful story. Using, you know, if it was just the voice, again, it'd be something, but to see some images that the individual chooses. Sometimes they're images that they take, and sometimes they're just images that represent their feelings, can be really quite impactful. And so digital storytelling has a tremendous potential and is used fairly widely to convey feelings from people and stories. Going into the next one, I wanted to talk about infographics, and I know that infographics are commonly used in the KT world, and they're kind of pseudo arts-based, I guess I would say. They use artistic elements, but they still convey data and a lot of words. This is an infographic that my team published a number of years ago, and what's interesting is we published this infographic in a small journal around the same time that we published the main paper describing this project. Whenever I talk to people, the infographic resonates with people much better because they basically get the experience of reading the whole paper in about 15 seconds. You can look at the infographic and understand what we did and what the results were, as opposed to reading this whole long academic paper. And so definitely encourage people to consider the use of infographics as a way to mobilize their knowledge. But in this project, as you can see, we worked with the group called the Calgary Diabetes Advocacy Committee, and I'll talk about them more in a moment, to prioritize or to decide what they wanted to work on. And at the very bottom, you can see kind of the results of our prioritization activity, where it showed that in both methods, the ranking and the rating method, by far the most important thing that they wanted to work on was addressing diabetes awareness and stigma, which got a higher rating than healthy food, access to medications, diabetes education, all of those healthcare. Really, this diabetes awareness and stigma were the things that they prioritized wanting to work on. And so after working with that group, there in the bottom right, you can see that that they decided that they wanted to create a film to accomplish or to overcome the challenges of stigma and lack of awareness in people. And so we created, together with the group, we undertook a participatory filmmaking process by involving the communities and the group itself in the process of creating a film to explore and address the issues of community importance, which in this case was diabetes awareness and stigma. And the community members themselves, that's the Calgary Diabetes Advocacy Committee, participated in all stages of filmmaking. They helped us plan what the film would be. They helped us write the script. They were there and present and advising on the days of filming, and also helped us with editing the film to make sure that it represented their lived experience. So this is the group of people that we worked with, the CDAC, and their objective and their mission is to bring awareness to and to change the experience of living with diabetes while experiencing homelessness. And the project that they wanted to undertake was this movie film, and we created the movie called Low, which is a 38-minute film that incorporates both a narrative film and documentary film in the conveying their stories and trying to increase the awareness. And so I'm realizing that we're running short on time, and I want to leave time for questions, but I do want to share just a brief snippet of the film so that you can get a sense of what it's like. I'm going to share my screen again. Share this one. So I'll share first just a snippet of narrative segment where you can actually hear people telling their own stories, and then I'll share the documentary piece and then the narrative piece after, which is a dramatized portrayal of their stories.
Diabetes sucks.
Well, my experience with diabetes was a rough one because I'm dealing with mental illness and addictions. So when I was in the shelters, I struggled with my diabetes.
I'm very difficult, very hard to cope with everyday things.
Being homeless, I mean, you're on, I don't know, I'll speak for myself. I was on guard constantly.
Trying to manage your diabetes and trying to successfully get out of a horrible situation that no one should be in. I struggled, man.
Yeah, it's just another thing to have to worry about.
It's just a accumulation of shit that hits you all at once.
Diabetes has caused me a great amount of bad self-talk.
So obviously that's the documentary piece where people are given the opportunity to tell their own stories. And then just to portray what a narrative film experience is like, their stories were all combined into the experience of this gentleman named Bobby. And essentially we can live their experiences through that we see through this dramatic film. And so we'll watch just a snippet of this part of the film as well.
Sunny Hill.
Hey, Bug.
Hey, Kevin.
How's it hanging?
Good. Can I get my insulin?
Sure, just back in a sec. Hey! Hey! Anakin, check his bag.
Bobby, Carter.
You bet. Let me get you signed in, Bobby. Welcome.
Can I get my insulin?
Yeah, just one sec. Sunny Hill Emergency Shelter.
You got any Fenny?
Hey.
What?
Seriously?
Yeah,
Fenny?
ambulance.
Fentanyl.
No, man.
You're good. Bobby, head on in.
Come on, Bug, I gotta piss.
Next Thursday? Let me just check the shift schedule.
And that scene there is really trying to illustrate the challenges that Bobby and by extension the members of our group had faced in getting their insulin while staying in shelters. And the film goes on to portray a number of other aspects of the challenges that we heard from our group. Let me see. I just have a couple minutes left, but I do want to tell you about how do we evaluate the impact of arts-based KT. And I think that's something we always think about in our knowledge mobilization efforts. How do we make sure that it's actually doing what we want it to do? And our group with Low, we created a quantitative study to assess the changes in audience members' knowledge, attitudes, and beliefs by administering pre-post surveys to those who watched the film. And we collected 202 surveys from 12 different screening events across the country. And what you can see, I won't go through all the details, but essentially the p-values, you can see all the way down on the left-hand side, the first p-value there, were significantly different. So that showed that people's knowledge, their attitudes, and their beliefs changed markedly from before the film to after the film across different domains. So both with respect to homelessness-related things like shelters and related to diabetes-related things. We can see a universal change in people's knowledge, attitudes, and beliefs. And we also went on to stratify the respondents to people who were familiar with homelessness, people who worked in the sector, worked in shelters. And you can see, interestingly, there that among those people, we're not successful, or sorry, that's not true. There was no difference between people who were and were not familiar with homelessness. So it seemed to uniformly change people's knowledge, whether or not they were familiar with homelessness. And that was true also for people who were familiar with diabetes for the most part. So this is a quantitative way that we could study, and we've also gone on to do some qualitative exploration of studying the film's impact. And so this is a study that my student Will Groenveld is currently undertaking, but we've conducted these film screenings across Canada in various shelters, and we've invited shelter providers to conduct or to participate in semi-structured interviews with us. And so far, we've gone about analyzing these using thematic analysis. And we've created these different themes so far, and some of them speak to the importance of arts-based KT. So somebody, said, this is an in vivo quote where somebody said that film is so digestible. You put a report out there, and some people like reading it, but most of us aren't going to read it. But with the film, people can sit and absorb it rather than actively reading it, which I think was quite powerful. Somebody said that watching this movie, it's like you're walking along with them, really helping you to understand somebody else's experience. Other people spoke about how the film allowed us to portray things in a very accurate and genuine way and show that we actually understood what was happening, which gave a level of credibility to the product. And finally, it helped people reflect. Somebody said, man, it shouldn't be that hard. You know what I mean? So that gets to kind of what we were really hoping people would take away from the film experience, is kind of coming full circle to having that emotional response and that emotional connection to the subject. So how do you get started if you want to do arts-based KT? I just put this out there. You can consult this if you'd like. I put the reference there at the bottom, but I really like this idea of deciding what you're trying to do, and is what you're trying to do objective or subjective, and is it more theoretical or more practical? And certainly a lot of the stuff that I do has been in this bottom right corner. So we call it interpretational, experiential, artistic art. So this is subjective work, like the stories of people, but practical in that it's meant to actually change something in practice. So I think a lot of the KT that we probably do will be in that bottom right corner, but it's important to realize that arts-based methods for KT can have other purposes as well, based on where our work is centered. Always important to consider your audience and how to best reach them, because you may create different artistic products based on who you're hoping to speak to. And lastly, as I said at the beginning, I want to come full circle to this, that consulting an expert is always important, because especially if you're like me and not a particularly art-apt person, you don't want to go alone in this road, but making sure that you have people with requisite artistic expertise to go along with the lived expertise and the scientific expertise. I think we can all collaborate together to do great things and mobilize knowledge in impactful ways. I hope we've covered these objectives, and I will end there and take questions for the last few minutes here.
Thank you so much. That was really, really interesting. So I did get a couple questions in the registration, so I'll start with that while everybody's thinking. So first question is, how do you determine with community partners which art methods to use?
Yeah, really good question. I think in my experience so far, the community partners I've worked with have not come outright and said, we want to do photo voice, right? They don't, in most cases, don't know what that is. And so the way that we've done it in the past is we've kind of, as I showed, identified what the priority is, what topic they want to work on. And then we explore together what different ways we could do that. And usually we kind of go through a menu of options and talk about, well, we could do this, we could do that. And the community will ultimately deliberate and tell us what they'd like to do. A good example is that when they decided they wanted to make the film, we had to decide whether they were going to be actors or would they not be actors. Most of them decided that they certainly didn't want to be lead actors, but many of them decided that they wanted to have a role in the film. And even just in that snippet that I showed, several of our community members are in that as kind of background actors and characters. And so I think true to the principle of community-based research is really it has to be them that decide. But as the academic partners in the room, I think our job is to teach them and to open their minds to what are the possibilities, because most of the time they're not going to know about it, and most of the time I didn't either. And so I had to go about and do some research and come back to them and say, well, we could do this, we could do that, and we ultimately settled on these things. So yeah, it's a collaborative, iterative approach, I would say.
Okay, awesome, thank you. Question just came through the chat, and they're asking, what would you suggest for how to approach vaccine hesitancy and inequity?
Really good question. I guess it would depend on who the target audience is. And so if you wanted to mobilize knowledge to people who were vaccine hesitant, members of the public who had vaccine hesitancy, that might be different. It might be a different arts-based approach than if you were trying to mobilize knowledge to policymakers who were, making decisions about vaccine availability or messaging, those types of things. And so, I guess I would say that a lot of times you'd have to consult with your community and whose stories you want to tell and who wants their story to be told. And as I said at the beginning, I think that's the real power of arts-based research, is that it tells stories in a moving and compelling way. And so I think for the issue of vaccine hesitancy, if you're able to, we know that working with those types of communities that are, skeptical of science and of data, then, just throwing more cohort studies and randomized trials at that community often doesn't work. But if you're able to tell stories of people who've lived either positive or negative experiences and how that, shaped what happened to them, I think that's a more powerful way to convey a message.
Sure, thank you. Another question in the chat, are you finding some agencies or opportunities more conducive for arts-based research funding?
Yeah, really great question. So the funding is always a challenge with any research project. But what I could say is that our movie was funded largely by Diabetes Canada, which, their historical mandate has been to fund biomedical and translational research. I think they have been doing much more in the health services space. But I don't know how much kind of arts-based stuff they'd funded before, but they were quite keen and excited about supporting this film. And then we've also had a lot of success with SSHRC. And so I think if your work touches on the social sciences, they do have a long-standing history and tradition of arts-based research in the social sciences. So it's not off the wall in the SSHRC world. I think I so far haven't gone to CIHR and asked, actually, that's not true. CIHR had a knowledge mobilization competition last year, and we received funding to support this type of work. So we've actually had success with Diabetes Canada, CIHR, and SSHRC now to support arts-based research. So I think it is becoming more widely accepted.
Great, thank you. Another question, do arts-based knowledge mobilization approaches typically require RAB approval, thinking specifically about the photo voice?
Yeah, I think it's certainly subject to the usual rules of ethics. And so if you're engaging with people, with human subjects, as they call them in the ethics terms, then you need research ethics consent. And so, yes, our photo voice project, we needed ethics and consent for the actual people taking the photographs and of people who were photographed in an identifiable way. We also had release forms and stuff like that. So certainly, I think any maybe not if you as a research team is creating the comics, right? That was one where I don't think there was any ethics involved because they were telling their own stories, and so they didn't need to recruit extra participants. And so Matt and Al were able to tell their stories through their comics. But I think if you're getting third parties, any other human beings to tell stories that are identifiable in any way, then you definitely would need to get ethics approval.
Okay. There's a couple more questions. I don't know if I'll have time to get to both, but do you have any additional resources to consult to help us understand how to take a quantitative or qualitative approach in arts-based knowledge mobilization?
Yeah, really good question. I don't have any specific resources for that. I mean, I think for us, that KAB approach, so knowledge, attitudes, and beliefs, as the quantitative approach, how we tried to quantify the impact of the film. And that's an old approach now. It's been around for about 20 years. It kind of came out of the field of rapid ethnography, somewhere we wanted to get at people's perceptions, but wanted to do it in a quick and dirty way rather than a prolonged engagement way. And it was quite useful for that purpose. So if you're interested in that, I think KAB has some advantages, but we realized it also had limitations, and that's why we wanted to supplement it with a qualitative approach. So I don't know if there's a specific literature on appraising or evaluating arts-based research, but I think going back to the usual principles of thinking about determinants of behavior and how we can measure those is what we're trying to get at.
Okay, I think last question is, I think can be done really quickly. In the Home Sweet Homeless film, were the people research subjects or co-researchers or peer researchers?
Yeah, absolutely. So in the film, Low, the co-researchers, they were co-researchers. So they were people with lived experience, but they helped us with the research design. They helped us with identifying the research question. They came up with the idea for the film. They helped create the film script. And so they certainly were co-researchers. They were not just patient partners or patient advisors. This is really their project and their story. And we wanted to really give the locus of control to the community.
Awesome. Thank you so much. We're at 1 o'clock here, so I don't want to keep anybody any longer. Thank you so much. And I think that was really, really excellent. And yeah, any questions that we didn't get to, I can send to you by email and we can get back to the asker. But thank you and have a great day, everybody. Take care.
Bye.
Bye.